Is there a medication for low blood pressure? Yes, this is a really good question. We see this quite a lot, particularly as people tend to get older. We always want to keep blood pressures lower because of the long term effects of it and the damage that it can cause the heart, the kidneys, the brain, things like that. But in some people, they generally have really low blood pressure. Now, when I was working in hospitals, sometimes we would tell people to just drink more coffee. We would also increase their fluid intake, their salt intake, because salt intake is directly linked to increasing blood pressure. And then we can even give medications. So medications would include things like fludrocortisone. So the way that this works is that it increases the amount of steroid in your body, which increases the reabsorption of sodium from your kidneys, which can then retain more fluid, which then increases your blood pressure. But in order for this to work, you need to be drinking enough fluid and having enough salt in your diet. And then if that doesn't work, there's another medication called midodrine, which it's an alpha adrenoceptor agonist, and it helps the blood vessels to constrict, which raises your blood pressure. Low blood pressure can be difficult to treat. In a lot of people, they can be completely asymptomatic and not have any symptoms associated with low blood pressure, in which case we may not necessarily do anything, but that's a discussion for you to have with your doctor.